Okay. Yeah, thank you for the invitation to give you a presentation about one of our research projects we run in the Catharina Hospital, with focus on the learning curve for ultrasound-guided peripheral intravenous cannulation in adult patients. Yeah, in modern day healthcare, hospitalized patients commonly require the insertion of vascular access devices with an estimated prevalence of peripheral intravenous cannulation up to 85%. Hospitalized patients need a peripheral intravenous catheter to administer drugs or fluids or blood products during their admission. And successful intravenous cannulation ensures prompt administration of these drugs or fluids intravenously. Although peripheral intravenous cannulation is the most common invasive hospital procedure performed worldwide, it's associated with an unacceptable high overall failure rate. And the consequences of an unsuccessful first attempt may seem innocent in nature, but can be decisive for both for the patient, for the caregiver, but also for the healthcare institution itself. And many devices have been proposed as aid to peripheral intravenous cannulation, including ultrasound, which is a non-invasive technology making peripheral veins visible on the extremity. And it can facilitate direct visualization of the needle being advanced into a vein. And we performed a systematic literature review, and we concluded that the success rate in the ultrasound group, in the group of patients in which ultrasound was used, was 81%, whereas a success rate of 70% was recorded in the group of patients in which the traditional landmark technique was used. And other results, ultrasound guidance reduced the risk for failed cannulation and improved the success rate, especially in patients with a known or predicted difficult intravenous access. It reduced the number of punctures and time needed to achieve intravenous access, and it increased the level of patient satisfaction, although it did not result in fewer complications. But although there are many published studies demonstrating the benefits of ultrasound guidance for intravenous cannulation, simply placing an ultrasound probe on a patient's extremity does not ensure cannulation success. The physical limitations of the behavior of ultrasound in tissues must be fully understood by the operator, otherwise failure of vascular cannulation will result. And to lower the threshold for applying ultrasound guidance during peripheral intravenous cannulation, different healthcare providers need to be trained and gain experience in using this technique. And training and practice will subsequently improve ultrasound use and increase success, at which success using ultrasound for intravenous cannulation is based on appropriate equipment and preparation, optimal vein selection, and effectively using ultrasound to understand and guide needle tip position. And therefore we created a study which focused on the number of ultrasound guided cannulations that is required in adult patients before a practitioner can be labeled as being competent, when the practitioner has no prior experience in using ultrasound. Competency on ultrasound-guided peripheral intravenous cannulation can be achieved after following a brief training in a fixed curriculum through completion of a didactic theoretical training session followed by hands-on training in a simulated environment, and which can be completed after a supervised live case training session. And we applied this fixed curriculum to our nurse anesthetists who participated in this study. And in the theoretical training session, lectures were used to support the transfer of knowledge, which was divided mainly into three themes: ultrasound physics, ultrasound guided technique of cannulation, and the vascular anatomy. And a hands-on training session logically follows the theoretical training, requiring trainees to gain and show competency before acting on live cases. And finally, during the live case training, trainees gain experience and routine in cannulating veins on the upper extremity with an ultrasound-guided technique in human subjects, in our patients, including patients with a known difficult intravenous access. We plotted our results in with custom analysis, and we were looking for an answer on the question: is it possible that nurses or any healthcare providers use ultrasound in clinical practice when they have no prior experience? And as you can see on the screen, the combination of the fixed curriculum, the theory-based training, followed by hands-on training and the supervised live case training session, resulted in a steep learning curve. In general, nurses were competent in the procedure after performing 35 procedures on live cases. And first attempt cannulation success increased as the number of performed procedures increased, of course, while time required to obtain successful vascular access decreased. As you can see on this graph, time needed to successful cannulation was around 14 minutes during the first training in live patients, as you can see on the left side of this graph, but decreased to around 3 minutes on the 40th procedure. So training of nurses in ultrasound-guided peripheral intravenous cannulation resulted in beneficial outcomes for daily clinical practice. Training in ultrasound use, going to the conclusion, should be part of general nursing education, as well as the selection of vascular access devices. Limited training in the use of ultrasound will result in failure to use this technology to its full potential, and methods to increase skillful use of ultrasound in difficult access patients and improving successful peripheral intravenous cannulation should be explored. A lack of understanding with regard to imaging the location of the needle tip remains a major obstacle. Eye-hand coordination. A clinician's proficiency in ultrasound is likely to improve efficiency, patient's experience, and safety. Most importantly, patient satisfaction is enhanced when nurses utilize an ultrasound-guided approach to insert an intravenous catheter in patients, especially in those patients with a known difficult intravenous access. And as a result of our study, or what we concluded, training and knowledge of ultrasound physics are important for success of ultrasound-guided procedures, and competency can be achieved or can be gained after following a fixed training curriculum.